Finally got back to my flu video. Real quick, I wanted to give some information about the flu to kind of fill in some of the other information we've already gotten. Regarding the vaccination plans, critical resources, incident managers, emergency responders are people they're looking at. These emergency support functions must be protected by being vaccinated. Transportation, communication, public works, engineering, firefighters, emergency management, mass care housing, human services employees, resource support, public health, medical service employees, urban search and rescue people, oil and hazardous materials response people, agriculture, natural resource providers, energy, public safety officials, security, long-term community recovery and mitigation officers, and people in charge of external affairs. They've already got plans to have their people covering all management positions 3D because they're counting on 2 of them being sick. Okay, I'm going to show you where I got that. From the Target Capabilities List, the companion piece to the National Preparedness Guidelines. U.S. Department of Homeland Security, September 2007. I showed this to you a long time ago. This is the one with the big American flag, all this happy stuff, prevent, protect. Okay, so that's where they get the list of who they would like to immunize first. Are all these important support personnel, transportation, if you're in transportation, health and human services, emergency responders, all those people. The next thing I wanted to talk about was H.R. 2596, which was in my school fencing video, to authorize the Secretary of Health and Human Services to carry out a demonstration program to test the feasibility of using the nation's elementary and secondary schools as influenza vaccination centers. This bill is being worked on. It's called the No Child Left Unimmunized Against Influenza Act of 2009. And there's several paragraphs here. It's not that big though. You could read this easily. They're saying school-based vaccination programs are effective and cost-saving. Children targeted for immunization will help efforts to build a sound foundation for future vaccination efforts. So if they get the kids, how can you not get it? School-based vaccination represent a feasible mechanism for community-based pandemic vaccination. School-based programs investigate conducting mass immunization clinics and building partnerships with local public health teams. And then they talk about, oh, it's going to help the absentee rate and blah, blah, blah. And that it's done through the government so the Secretary of Health and Human Services can work on getting payments for the program. And all children age 5 to 19. So take a look at that. It's called H.R. 2596. The final thing is I got the pupils may be first for swine flu shots article in the paper from July 10th. Washington, U.S. swine flu vaccinations could begin in October, with children among the first in line at their local schools, the Obama administration said Thursday. They urged states to figure out how they're going to tackle the virus's all but certain resurgence. We may end up averting a crisis. That's our hope, said Barack Obama. No final decision has been made on whether to vaccinate Americans. It depends on studies with experimental batches that are set to start the first week of August to see if they're safe and seem to work, and whether they require 1 or 2 doses. But if all goes well, the federal government will buy the vaccine from manufacturers and share it for free among the states. How pleasant of them. First in line will be school-age children, young adults with risky conditions such as asthma, pregnant women, and health workers. Unlike regular winter flu, the swine flu, human swine flu as they call it in Australia, seems more dangerous to these groups than to older people. So it really looks like they're going to put the kids in school and then start the vaccinations. Our schools start in August, and the paper says August. I showed you the video of the school fences. I have others on my favorites of 12-foot fences in the UK in primary schools, double gate. So I'm very concerned about that, and I hope you can all keep an eye on it too. The figures, you have to keep an eye on yourself by going to RSOE-EDIS. I just track them because it's the one I've been tracking from the beginning. I don't know whose figures are accurate, if any, but at least I'm tracking the same group, and it's going up very slowly, gradual incline. So I hope you all are prepared. I still advocate secondary infection medication to be stored somewhere in case someone gets pneumonia or bronchitis or sinus infection from the initial flu. I know it's really hard to get in the hospital here, and it's also almost impossible sometimes to get a doctor to give you antibiotics. So I'm still going to advocate being ready on your own. I wish you blessings, and I'll tell you the update about the personal stuff in another one. Hang in there.